Welcome, and thank you for attending today's Ergo Expo webinar. In just a few minutes, we're going to meet today's speaker, Keith Osborne, an ergonomist whose programs have saved companies more than $30 million in potential lost cost. But first, I want to thank our sponsor, Cardinus Risk Management. For more than 15 years, Cardinus has been delivering innovative safety and compliance risk management solutions to help their clients save money, lives, and mitigate risk. Cardinus has a global network of consultants who are industry experts with the experience to design, develop, and deliver comprehensive solutions. We are thrilled to have them sponsor our event today. We also want to thank our media partner, Industrial Hygiene News, and our academic partner, the Center for Occupational Health and Safety Engineering at the University of Michigan. Okay, let's talk about today's speaker, Keith Osborne from Seattle City Light. Keith holds degrees in Applied Management and Business Administration, and he's a Certified Ergonomic Assessment Specialist, Certified Wellness Specialist, Master Fitness Training, Six Sigma Green Belt, and an author. He's a recipient of Honeywell's HTSI Health, Safety, and Environment President's Award and his 2014 Aerospace Outstanding Engineer and Innovator Award. You'll be able to ask Keith questions during the event. Just use the Q&A panel located on your screen. Since we're talking tech, here's another reminder. Be sure your computer's volume is turned up so you can hear the audio. If you experience any issues with the audio, please press the request button in the participants box at the top right corner of your screen to receive further instructions. Within 24 hours, you'll receive a link to an archived version of the presentation, which will be available online approximately 3 days after today's webinar. And it will be available for 1 year. If you encounter a problem during today's webinar, please contact WebEx Technical Support at 866-229-3239. After today's webinar, a short survey will pop up. Once completed, you will then be able to print a certificate of completion and use it to apply for CEUs with ABIH and BCSP directly. You can easily view today's or previous webinars in the Webinar tab on ergoexpo.com. On the right side, you'll see all the available on-demand webinars for you to view at your convenience. For even more ergonomics education, plan on attending the 2015 Ergo Expo. Keith is just one of the many expert speakers we'll have at this year's event. And today's webinar is a perfect example of the high-level education you'll get at the conference. Plus, you'll have the opportunity to see and compare all the latest industry products. And with that, let me turn this over to Bill Pace of Cardinus.
Yes, thank you, Dan. I want to thank everyone for attending. And especially thank Keith Osborne for really putting this presentation together. And just to give you an idea, Keith has really spent the better part of 4 to 5 years in his diligence to better understand and what makes the ROI click and work within organizations, not just with stakeholders, soft versus hard costs, indirect versus direct, but understanding how bringing this all together in a measured value to help with the program and creating more proactive case study for where we need to go in the health and safety world. And just know that this is really just is also a prelude for Keith and the better understanding of data for case studies that he's going to present in detail at the Ergo Expo on Wednesday. So today is really giving you a better understanding of how he's come together to bring together the stakeholders and the costs. So with that, Keith, the floor is yours.
I appreciate that, Bill. Dan, thank you. And everybody, welcome. This is my first webinar that I'm presenting for the Ergo Expo. This is not the first time I've spoken on behalf of the Ergo Expo. It's always an honor and a pleasure to be able to do that. So the topic today is payback time. Proving good ergonomics is good business. And what I want to kind of delve into today is how we can find out where your program is, kind of define what your stakeholder goals are within your organization so you can better define those and lay those out within your process. Also talk about leading and lagging indicators and some available tools. And what I mean by that, online tools that could be available to you to actually enhance your program and kind of make it multidimensional. Building your own metrics. If a lot of the nice tools that are out there today already have built-in metrics that they can track for you, but also there are some other metrics that you can build on your own to actually enhance what those tools can do for you. And then we'll go ahead and review and wrap up and answer some questions. So where's your program? It's a very important key to try to understand the health of your process. You've really got to know where you are in the existence of building an ergonomics program, how your ergonomics program or process actually ties into to the overall picture of your organization, and whether or not you're actually building a multi-dimensional one with possibly a wellness aspect tied into it. So what stage are you at? Are you non-existent? And what I mean by that, you really don't have a formal program. You're kind of just putting Band-Aids on big wounds and hoping you can kind of tread water. There's no mechanisms in place to either measure, assess, or correct what you're trying to do. So you really have no idea what you're doing is even effective. So the next one would be reactive with no formal support. So you're reacting to some of your lagging indicators, your injuries that get reported, and then you're gonna do a corrective action based on those. You can assess and measure, but many of those actions need medical notes or some other additional approval prior for your implementation. The next would be reactive with support. You can assess and measure. There's no preemptive nature to the process, but you have some support, but it's not really a focused support. It's, yeah, we'll help you a little bit, but there's really no definition to your program at all, and you're still heavily reliant on lagging indicators to get you through month to month to year to year. Are you early proactive? And this is kind of where you get your program to where you can get some headway and get in front of some injuries, as opposed to always looking at the OSHA logs or looking at your injury reports and saying, okay, now I have to act. If your program's at this kind of a stage, you're already getting ahead of the ball game on some of your things, be it an industrial, manual material handling type of an injury type program, or an office program, or a combination of the two. Is it a really mature and proactive process? Your leading indicators are going to drive that process, as opposed to the lagging indicators. Lagging indicators are going to be used more for your historical data at the end of the year. How did we do? Are we progressing? Is there some continual improvement that we can actually see and measure? Online tools are really good in this use, and they help you build metrics as you go. The other thing that you can use that online tool for is to set yourself up for the very next year. Again, not to give away my other presentation, but when I worked at Honeywell, I used the online tool as a basis to baseline the very next year. Everybody would take their assessment at the end of the 1 year. The next year, everything would be ramped up. So we knew who high, medium, and low risk folks were, and we went from there. The self-governing proactive process. This is when everything is almost on autopilot. Lagging indicators are showing your validation of your process. Your leading indicators are driving what you're doing. And your stakeholder buy-in is just absolutely complete. If you need something, you can get it. If it's on hand, you can move quicker with it. Those kinds of things are already there for you. And annual baselining from annual assessments. This I think is kind of crucial to being a self-governing proactive process. If you can annually baseline your company, you'll know exactly where you are all the time and what areas need a little bit more emphasis than others, and everything kind of just falls into place. You have an understood ROI, and you use it to mold continuous improvements within your organization. Excuse me. So what's needed to get your process elevated a little bit? Probably some structure. Some folks that I've talked to in the past, folks I've talked to at the Ergo Expo, and clearly when I started building processes, the most important thing is have something written, have something defined, and have a process in place that can physically be improved by what you're trying to do. You want to make sure that you have your stakeholders identified. Who owns what, and who are those stakeholders? And based on that, what are they going to be able to contribute to the overall success of your process? And then you got to hold everybody accountable. And that's what the metrics and the reporting and the data does. it allows you to know who's doing what and who needs to maybe step up their game a little bit to add a little bit more support to your overall process and to the organization's overall process improvement and what they're really trying to do. Is it injuries they're trying to drive down? Is it healthcare cost runs that they want to drop down? Those kinds of things, you need to flesh that out, and all that needs to be understood within the process itself. And then some case study data. Best place and best thing to do is to get a case study built and present that to your organizational team, your management team, so they understand with this case study, you can go ahead and have a good start for your maturation process and get buy-in, additional buy-in from folks who may be sitting on the fence and aren't really sure that your ergonomics process is what they want to support. A good case study will get that for you. And it's kind of often the win or lose point for management support. You either have a good case study with good metrics to prove that the ergonomics is going to be a benefit, or you don't, and you're either going to get it or not from there. So let's talk about stakeholder roles. Who are the stakeholders, and what do each of those folks bring to the table? This is a kind of a critical piece in defining that process as well. Everything has to be clearly defined. So the questions you kind of want to ask yourself within the stakeholder role defining portion is, who are the stakeholders? What are the roles within the process? And what are the roles outside even just the ergonomics process, but what are their roles within the organization as a whole? Who's going to champion that process? Generally it's probably your ergonomist or someone within your staff. If you don't have a staff ergonomist, then who within that staff, that organization, is going to really take the lead in the ergonomics process and support the consultant if you have a consultant coming in? How do you get buy-in from all the stakeholders? And we'll talk about that here in a little bit. And what are they accountable for, the metrics or the process inputs? So defining the stakeholders. The ergonomics program coordinator, it could be, you're hoping it's somebody with a lot of knowledge of ergonomics or some background of ergonomics, so they really understand the overall process of ergonomics. You want to make sure that they have really good, well-maintained records. Archival records are really good, like I said, to initially baseline an organization. Up here at Seattle City Light, the best thing that they had was their OSHA 300 logs, so I dove into those and kind of got injury trends, and I used that analysis to kind of understand the sore spots here at this organization, and then we could attack those. You want to be able to schedule manager, supervisor, and worker training. Everybody has to understand ergonomics holistically. They have to understand what Ergonomics 101 is. If everybody is on board and has a good, clear understanding of what ergonomics is and how it could benefit their processes, it really goes a long way to getting that buy-in to get the program developed and move forward. You want to maintain training records. You want to include all the dates of the training, the topics, and all the materials used, everything finitely down to a piece of paper. And then monitor the program at least annually. Internal self-audits, outside audits, anything that you can think of that could help you find out what the status is and the health of your program annually. It really helps you going forward and helps you as far as building for the future. The ergonomics program coordinator is also going to try to ensure that the personnel performing the worksite evaluations and the training are properly trained. It's great that your lead ergonomist has that knowledge, but he or she has to be able to pass that down to the folks that he's going to have helping him and assisting him or her in moving this program forward. There are 1,900 people up here at Seattle City Light. There's no way I can run this program on my own. So one of the first things I'm trying to do since I've been up here is to get other people in the outlying sites and other organizations trained on basic ergonomic principles, so they can spot things that maybe need my attention, or they can already go ahead and solve those on their own. You want to ensure control measures are implemented in a timely manner. You don't want to have to order somebody a chair and wait 2 months for the chair to come in. Order them a keyboard tray or a tool for whatever you're trying to help with their job, and have to wait months for that tool to come in. You want to make sure these things can get to you really quick and be issued and assessed so they can actually impact that worker quickly. You want to ensure that a system's in place for workers to report those signs or symptoms. Again, an online tool is one of the best ways to do that. It's available, it's streamlined, it has specific questions, it triggers specific responses, and these things can be collated into data that you can use to make actionable corrective action. Your managers, you want to make sure that they maintain accountability for the health and safety of all their workers. That's what they're there for. They're there to support the workers. Your workers are the most important part of your organization. Without them, your organization really doesn't exist. So the managers need to be able to know that, or to let the employees know that they have their best interest in mind. They need to be able to allocate human and financial resources. Have the money available, have the people available to implement and to buy and get those things in place. And that you want them to attend ergonomics training so they can get familiarized with some of the things. And what some of those things are would be work-related ergonomic risk factors. What are some of the musculoskeletal injury signs and symptoms? The requirements and procedures for early reporting, and some of the medical management. Who do they need to go to? If something, in fact, has to go to a workman comp claim, who can they go to for some guidance on return to work and those types of things that are going to impact both him and the worker that's out. Managers also need to try to ensure that their supervisors and workers under them have received that appropriate training. And the same thing about the practices and principles. They need to have a cursory idea of what a worksite evaluation is about. So if you have an online tool, walk the managers and walk the supervisors through the ergonomic assessment tool so they have an understanding of exactly what this is how it's going to benefit them. And then also walk them through the administrative section of that tool so they understand what kind of data is being stored, how that data is being used, and the kind of metrics that are being built. Productivity cost runs, those kinds of things are very important to managers. If you can show them that you're saving them money and improving their productivity, all the while also driving down injuries, you'll have a much better and much easier time in trying to get buy-in for your organization. Defining your stakeholders, again, supervisors, you want them, again, to attend. You're going to see this repeated a lot. Everybody should attend some sort of ergonomics training. Supervisors, again, they need to know the same thing as the managers. Because if the manager's out, one of the supervisors is going to have to step up into that role. Again, they want to make sure that their workers have received the proper training. And they want to make sure workers are provided and they use the appropriate tools, the parts, and the equipment in accordance with the ergonomic requirements and your ergonomic standards that you're trying to impart on them. It doesn't do any good to buy really good ergonomic stuff, really good keyboards, mice, really good ergonomic tools, zero balance arms, things of that nature, if they're not going to use those things properly. The other thing you want to do is you want to ensure that the workers understand signs and symptoms early, and so they can report them early, and so that way you can correct them early so they don't become something a lot more critical. You want to make sure supervisors respond promptly to worker reports. It's one of the things up here at Seattle City Light that we're still working through. There are some organizations that work better than others. Some organizations are a little bit quicker at reporting than others. And as I go through and provide training during safety camps up here, it's interesting to see supervisors who are starting now to understand. The quicker we can get this fixed, the better chance of we're not going to lose a worker to an injury. And then now I have to start planning for overtime. I have to start planning for other lost time. I have to shift other workers around. I have to change my entire project management layout that I had for a specific project or a job that we're going to do because now people are out. Provide appropriate worker comp documentation to workers and make sure it's in accordance with all the regulations. You want to make sure your employees know that process. If any injury gets to that point, you want to make sure that they know the process and what they have to do to go through that smoothly and as painlessly as possible. And you want a supervisor to know that they have the ability to exhaust all avenues to help an employee get either healthy or to keep them healthy. You want to also let them know that they can seek clarification from HR, especially for a return to work initiative or directive. Especially if something from a healthcare provider is not really clear and they're really not sure how to implement what that healthcare provider wanted, HR can be that buffer to talk with the healthcare provider and then talk with the supervisor and say, okay, this is exactly what that healthcare provider was asking you to do. And that way we don't re-injure an employee or make an injury worse. If there's an alternate work directive given, that's fine, put that in place. Use the ergonomist. The ergonomist is there to ensure that that workstation, that the job tasks are still fitting that worker. If that worker needs an alternative work directive, then that alternative work directive can be assisted by the ergonomist in making sure that we, again, don't cause further injury or cause another injury. And then they also want to make sure that they're the buffer between the manager, the senior manager, and the workers. And getting to the most important piece here, the workers. When provided, they use the appropriate tools, the equipment, and parts and materials. They make sure everything that they do is done correctly, and it's as directed by the managers and supervisors. If you don't have a process written down and it's not followed and enforced, you don't have a process. And I've said that. If anybody's ever heard me speak before, I've said it 100 times. If it's not written down, it doesn't exist, and if it's not written down, you can't measure it. So the whole thing about having processes written down is there's something right there for everybody to follow, so that they understand that this is what we have to do, and we can execute efficiently and consistently over a given part of time any worker that comes into that job. We want to ensure that the equipment's always properly maintained in good condition, and when it's not, it needs to be reported so it can get replaced. Because broken equipment can cause people to use it improperly, and then now we've got another injury. And also have them attend ergonomics training as required. At Honeywell, we made it an annual requirement. Here, we're not quite to that level yet. We're still kind of more in a reactive, cruising to proactive mode here, but we're going to get to that point where we're going to be able to give ergonomics training annually, at least a refresher, and then also have online assessments done annually too. That's, again, to help baseline your organization. Some more stuff for the workers and defining what their roles are. Report their symptoms early. Report work-related MSI risk factors to the supervisor as early as possible. The sooner you can fix something, the sooner you can drive down and mitigate that risk, and drive down and mitigate some of that discomfort. And it'll also help you keep those cost runs low, so that way you're not spending a lot of money on something that should have been caught early on. You want to make sure that they take some responsibility for their personal health and safety. It's not all on the organization to keep the workers safe. There's some inherent kind of common sense things that employees they need to do. That's why the processes need to be written, so they can refer back to it if they have a question before they go do something. And you want to be able to empower your employees to take charge by allowing them to do annual self-assessments. I think one of the best things that happened to ergonomics and ergonomists in general is the fact that online tools were developed to give employees some ownership over the ergonomics process. It really does. It was amazing when I did this down at Honeywell. They were actually looking forward to the annual assessments by the time the program had matured, because it was something they could say, okay, what do I need to check? Have I gone back into a bad habit? Those kinds of things. And the online tools are vital to that. Employees can self-correct their issues, many of them with just use of the tool. And if not, the ergonomist is always available. And then the online tools will alert the other stakeholders if there's a high-risk employee that gets reported. And some other specific departments they have a stake, but they don't. They generally fall into other categories to discuss. But I wanted to break these down specifically. HR, a huge part, especially with the return to work issues, workman comp, ADA. A lot of times the wellness coordinator is located within the HR organization. And for me, I really believe there's a huge integration between wellness and ergonomics. And the more I look around, other organizations are showing that that's becoming more prevalent too. Health and wellness, keeping your employees healthy, exercising, proper eating, proper diet, proper sleep, stress management, time management, but then also making sure the workstation is set up for them. That's another physical nature and physical aspect of their overall well-being. So I think these two things, and I think as years go on, you're going to see these things become more integrated. Finance, they're the ones with the money. And if you can't show through your case studies that you're being effective with the money that they're giving you, you're not going to get very much after a while. So your good metrics are going to drive your budgetary considerations, and your good metrics are also going to drive your ability to expand your program and to add things and to be able to try things and to think outside the box and continuously improve your process. Excuse me. Facilities, those guys do a lot of the heavy lifting for you. Workstation reconfigurations, furniture changes, possibly even an entire facility change. We just actually built a new facility up here for our metering tech crews. And they did a really nice job with the facility. And there was a lot of really smart ergonomic consideration into this build process, which I was really impressed with. They could help you with lighting and HVAC and order a lot of the non-IT equipment, the keyboard trays, monitor arms, those kinds of things. Safety. Many organizations, they own the process. Some it's an HR function. Safety here at Seattle City Light actually falls under HR. It falls under the HR director. So it's a kind of a different animal here as opposed to Honeywell, which was more aligned with facilities. Ergonomics process owner in many cases has a safety or an IH background as well. And some organizations have a safety and facilities department together. Engineering, these guys are critical. Anytime something's getting designed within your organization as part of anything mechanical, any kind of a design for a building, facilities, cable runs, doesn't matter what it is, these guys are critical. And the thing that the ergonomist needs to be able to impress upon the engineer is, hey, looky here, if you're going to build this, let me take a look at it really quick from a anthropometric and biomechanical standpoint to make sure that what you're building is actually going to be able to be used properly. And then we don't have to re-engineer something later on and add cost to an end of a project. So how do we get buy-in? It's kind of been my that you build case studies, it's been, you use a cross-section from your organization to build your case studies. The case studies are really a key to garnering money and garnering support from management. They show you and they show management how you can actually put ergonomic processes in place as a continuous improvement mechanism, but also as a way to improve what's happening now. Use a cross-section of your organization. Don't get everybody from one department. Don't get everybody from the finance department and submit a case study and say this will happen and this will help the entire organization as a whole. It's best to get a few people from every part of your organization as part of your case study test. You want to utilize both online and one-on-one assessments. The reason you want to do this is the online assessments will give you instant feedback. The one-on-one assessments will allow you to validate a lot of the things that you see in the online assessment, but also gives a face to the process, and it allows you to really see how people interact with their workstations, with their job tasks, and those kinds of things, so you can really understand the root cause of what was actually put on that online assessment. You want to be able to show efficacy by developing the metrics that show your improvement. Metrics support your process, and if you can measure it, measure it. If you can define it, because the more data that you can come up with, and it doesn't really have to be really highbrow, high-level type data. It could be very simple data. But the more data that you have to support the fact that you're building this process to benefit the organization throughout the organization, the better off you're going to be. An effective process develops and it matures and it maintains these metrics continuously. Every month that you can go back into an online tool and see your progress, see the root cause analysis, see productivity trends, see discomfort trends, and awkward posture trends, those kinds of things. And on the fly, you can shift your focus to ensure that none of the high-risk things are falling through the cracks. All this data is really going to become the cornerstone of your process, and it's going to be what you're going to be able to use going forward to show your efforts and to show how good you're getting with streamlining and focusing your program. So let's talk about some indicators real quick, leading and lagging indicators, and how they can work for you. A lot of the metrics and data that you have will come from recognized leading and lagging indicators. They can provide the basis for the start of your process, but they will also help guide your process throughout. So what are they? Lagging indicators, they're generally historical data. It's generally injury trends, days away, healthcare cost trends, and that's just an example. There's tons of them out there. They're excellent to see where you need to initially focus your efforts, and it's a really good way to track your year-end process, especially when you do an internal or external annual review. your lagging indicators are going to show you what you've done to date, and it also give you a jumping off point for where you need to go. Some other examples, OSHA 300 logs, near-miss trends, some places call them close calls, workman comp costs, the incident rates, and your productivity trends that you're tracking. Leading indicators, what are they? Well, when they're properly developed, they can build into a best practice. They allow you to get out in front of issues. A leading indicator is something that's happening. It's active on-time, real-time data, and it's used to flesh out your case studies. Some examples that I use, ergonomic opportunities identified and corrected. How many ergonomic opportunities have you been working on, and how many have you already corrected, and are you seeing tangible results from those already? A reduction in your MSD risk factors. It could be also a lagging indicator, but I think as you monthly check this and as you keep revisiting and reassessing, you can use it as a leading indicator to show process improvement on the fly. Employee perception surveys. Every once in a while, send out one of those Survey Monkey things. Get an idea, get a pulse of what the employees think, not only an overall safety process, but also your ergonomics process, your wellness initiatives. And from those, you can see where there's some low points, some high points, and work on those low points to get those better. Safety audits, I talked about those earlier. Internal or external. Honeywell had one that they had to do every year was an internal audit. And then every 3 years, they had an external auditing team come in and do the same thing. And it really worked out well because it lets you know right where you're at and where you need to go. The internal audits are great because you self-correct. You look at your own data, you look at some weak spots, and it gives you that impetus to find other ways to continuously improve. High-risk employee reduction. That goes back to using that online tool. How well are you working through your high-risk employees, and how many of those turned into an injury that was recorded and had to go into workman comp, and how many didn't? And then your return on investment. You can track that continuously, and how well are you getting that return on investment? You know, how many dollars are you spending, and how many are you saving as a result of what you're doing? When I left Honeywell in 2014, I left the ROI at that time was 40 to 1. So tools, you can either build them or buy them. I think it's a whole lot easier to buy them because building them, that takes a whole lot of effort. And I really applaud the companies that do come up with these online tools because I can't imagine the amount of effort that goes into trying to design one of these things and then make it easy for someone else to use from the outside. So I really do applaud all the companies that do come up with these things. So how do you flesh out your indicators? What do you want to measure? Are you looking to drive down injury rates? Are you looking to impact healthcare cost runs? Is your desire to impact productivity because maybe your injury rates aren't that high, but your productivity is lagging? Or are there specific processes that you really want to make more efficient? So you got to kind of understand where you want to go with that. Or is it a little bit of all of that? And then how do you want to measure it? Preferably you want to do leading and lagging. But again, if you're one of those programs that's just starting out, lagging is where you need to start because you really don't have any leading indicators developed at that particular point in time. So a lot of companies already have some metrics built in. HR tracks days away. HR tracks a lot of other data, healthcare cost runs, comp costs, those kinds of things. So they track those. They also have the OSHA 300 logs that are always available. Those have to be turned in all the time. So you have that archival data that you can use. You can develop your own spreadsheets. I developed an ROI spreadsheet that I use that tracks, how much an injury costs, how much the indirect cost is, what your corrective actions are, how much those corrective actions cost, and then based on all that, how much did you save in mitigating the risks of those, so those individuals or those issues didn't become a workman comp claim, and then a very loose ROI of how many months did you realize that return on that investment. And it really became a very handy tool for me as I went forward. Productivity markers. This is really especially true for like a Lean Six Sigma organization. And if you're really getting your process down to that Lean Six Sigma level and mentality and modality, productivity markers are critical to seeing where that organization is. So use some online tools. Office and industrial tools. There are some out there that do both, but find one you're comfortable with. Find one that suits your eye and suits the metrics and data that you want to glean and cultivate from what you're trying to build. At a minimum, you want to make sure that they track high, medium, and low risk categories. So that way you know where your organization is sitting and who the folks are that are at the most risk. If possible, you want one that can also give you a productivity tracker, efficiency for the employee pre and post assessment, efficiency for that job, pre and post job task assessment. And then also maybe something that can show you some root causes. Because if you can delve down into some root cause analysis and kind of get rid of that behavior or that mechanism that's causing maybe a bulk of your injuries, you've got a way better chance of diving into your injury rates and getting those things down. A lot of these tools also have built-in training to assist you in management, and it's going to save you a lot of time instead of saying, okay, hey, I'd like you to go attend this training. As soon as they're done with an assessment, they already have the training assigned to them. They don't have to go anywhere to go do it. And make it real simple, short and sweet, a couple minutes for each little indicator. Maybe they're using their mouse wrong. Maybe they're using the keyboard wrong. How can you set up their monitors properly? Those kinds of things. Real short, real sweet, right to the point so they can do a self-correction. A lot of them also will track training metrics. So that training that gets assigned, you now have a metric of who's doing the training, and also some of the other tools that are out there will allow you to assess how effective that training is, because the employee can say, was that a training effective, and did it meet your needs, yes or no, click. And just about every one of them now is customizable to fit your organization. So you can get one built that will do exactly what you want just for your organization. But again, like I said, the one that you want to pick is the one you're comfortable with. Like I said, they're almost all customizable. You can tailor them. Get a risk score tracker, productivity trend analysis, high and medium risk employees, and some root cause analysis. If you don't like it, you're not going to use it. So that's why I keep hammering the point about making sure that you get one that suits your eye and you're comfortable with. But then the other thing is you want to make sure it's easy for the employees to use. If the employees are not going to use it, then you have a tool that's useless. It's just going to sit there and you're not going to get the data you need. You're not going to get the metrics that you want to be able to drive process or continuous improvement within your organization. So you can also develop some of your own. You can build some of your own metrics if you want to. Ergonomic corrective action effectiveness. You can use this to show how effective your process is. You know, how many of your workstations are high, low, or high, medium risk, and you can get a percentage of those. And as you work through the year, your percentage of low to medium and high risk, it should change more into the balance of low risk as you work through your issues with your employees and they get more comfortable in a workstation or a job test that fits them. And then again, you can also you can baseline this every year annually using your online tool. Proactively mitigate high-risk employees. The online tool makes it a whole lot easier because then you're not dealing with paperwork, a missed email here, something along those lines. You can go right into the tool, pull that data up, you know who's a high risk, and then you can get an action plan to build off that data from your trend analysis, and then you can go ahead and dive in and correct these things. So, like I said, I talked about that spreadsheet. I did a direct cost of an injury plus the indirect cost minus the equipment cost minus your labor cost, and that's the savings, just a monetary savings now that you can show somebody that hey, look, our high risk employee, we mitigated the risk. It didn't go to a con claim. It didn't go to a lost time claim, and this is what we saved money wise. And that ROI calculator can determine how effective the program is, as long as it's being worked in conjunction with your program. Again, develop some more internal and external audits are important. Audit results are really key. It's a nice way of having somebody else take a look at your process. Having a new set of eyes on a process or procedure, especially if you've been there for a year or two or three or four, it's really good. It gives you some really good actionable corrective actions to take care of. It's a way forward for some additional improvements for your process, because every process could use continuous improvement. It doesn't matter how successful your process has become. There's always something that you can add to it to even make it more successful and a lot more efficient. Okay, And then these audits also validate some of the things that you think are actually working really good. If you think something's working really good, an internal or external audit's probably going to show that. And then you can say, okay, good, we're on the right track with this. And if it shows that maybe you need a little bit of work, that's good too, because you can take that data and tweak your process or tweak your stakeholders or tweak whatever you need to tweak, but get it back on the path that you think it needs to be on. Track training completion. You want to always track a training completion percentage. It's always good to know, and because it also lets you know if it's effective. If training's not being completed, there's a couple things wrong. Either they can't access it, or word of mouth says that the training's not very good, so they're not going to take it. So there's a couple of good things that you can kind of glean from that percentage of tracking training completion. So let's go ahead and review what we've talked about up to this point. So the first steps for any organization, you want to figure out what their understanding of the ergonomics process is and where their ergonomics is. Do they think ergonomics is just like a nice shiny option, like a really big, huge nav screen in your car? Are they not sure how to integrate it? They see ergonomics as a tool, but they just really don't know how it fits into the overall fabric of the organization. Is it a key process integrated into every aspect of the business? Ideally, you want to make sure that sometime down the road, as you continually improve your process, number 3 is where you want to be. Is it a key process integrated into every aspect of your business? If it is, we're driving a very successful ergonomics train down the tracks here. You want to know where your program is at. Is it non-existent? Is it proactive? Is it reactive? Is it a combination of some of those? And is there some mechanism already there, or does it need to be developed to show continuous improvement? We want to also make sure we define who the stakeholders are. Who are they, and what are their responsibilities in the process? It clears up any misunderstandings of what HR maybe has to do versus what facilities, versus what safety, versus what finance. Everybody knows what you're supposed to do. Management, supervisors, crew chiefs, employees, everybody understands what their role is. Everybody understands what they can contribute to the process. Not just the ergonomics process, mind you, but every process throughout the entire fabric of your organization. Accountability. Every accountability process is measured by how well the stakeholder contributions are measured. Are their duties, they being the stakeholders, are their duties to the process clearly defined? And again, are there annual reviews, internal and external? It's been my experience that both of those, internal and external, are kind of crucial to really fleshing out a good process. And some shameless plugging here as I wrap up. I'll be talking at the Ergo Expo on Wednesday at 8:30, and the session as it's listed here. Some of the things we're going to talk about. We're going to go deep dive into some case study issues, and so you can kind of understand some of the stuff I talked about here. What were the results of that work, and how did it actually show up in how an organization got a little bit better with their ergonomics process? And a little bit of this. And barring any questions, I appreciate everybody's time, and thank you for dialing in from wherever you dialed in from. Dan, Bill, Matt?
Well, we do have some questions, Keith, so why don't we get to them?
Okay.
We have a question here. Do you have any advice on improving productivity gains in the office environment? And she's talking about knowledge workers.
Yeah, well, sort of. when I was at Honeywell, the part of Honeywell I worked at, they were a defense contractor, so everything worked off of work authorizations. So how I measured that productivity was how fast or how efficient they were in closing work authorizations, and I used that on-time closure data as a success metric for productivity increases. So if they were able to close work authorizations quicker and without mistakes or rewrites or things like that, then that was counted as a productivity increase. And when the end of the year came and the Air Force and everybody did the review, all that kind of fleshed out, and I could see where productivity was gaining or maybe where I needed to start helping other folks with their processes. So that's kind of how I did it within an office environment, because that was pretty much that was, I would say, an 85 to 90% of an office environment, and 10% was field work on satellites. So.
Okay, great. Somebody asked here, what has been the biggest obstacle in your current position?
Wow. In my current position, and I said it at the beginning, this is kind of a different animal because it's a public utility. Mm-hmm. There are a lot more layers to go through for approvals. So I think my biggest obstacle is still trying to figure out the players and owners of all those approval processes and getting them in the same room and saying, how can we streamline these things and make them look a little bit faster? To date, we've done pretty good. When I first got here, it took about 2.5 months to get a chair. Now we're down to about 10 days. So we're making some progress. Same thing with other pieces of office equipment. The field environment is a little bit tougher to crack because you've got guys that have been doing that type of field work for 20 years, and that's the way they've done it. And I don't need some office ergonomist guy coming in and telling me what to do. So I would say that was the biggest nut to crack.
Okay. Question here. What do you use for the cost of injury measures when doing ROI?
I went to the National Council for Compensative Insurance. I also used some OSHA data and some Liberty Mutual data, and I kind of took averages for specific body part injuries, back, wrist, shoulders, neck, and that's what I use for my data.
Okay. We have a question here from somebody who their organization will only okay sit-stand computer workstations for people with medical authorization. So the question is, to what extent do you think sit-stand computer workstations might reduce future injuries?
We have that same issue here. So this is a really good spot-on question. I like that one. Seattle City Light's in the same boat. You have to get a medical authorization, a medical accommodation, as they call it here, to get one. The nice thing about it is the facilities department up here is slowly retrofitting all the workstations with these devices because they understand the efficiency of these. And the reason they've seen that is because the ones that have come through while I've been here, I have the data to support the fact that discomfort levels and risk levels are going down, and the people who use these, their productivity is increasing. So they understand the benefit of using these if they're used properly, and it's kind of slowly changing their perception of this. It's not going to change anytime soon because obviously that's one of these things where the public utility has a financial doctrine that they have to follow. So as they get more money, more people will get these workstations.
Right. Question here from someone says, given that most people don't have time to read written documents, how detailed do you think a written program needs to be?
Not very long. The one I wrote for Honeywell, I think, was 6 pages.
Wow.
So it's not really long. Really short. This is what you're responsible for. Here's as far as the office ergonomics part of that process at Honeywell, it was merely a way of to do an office ergonomics process. This is what we're going to do. Contact your ergonomist, contact your supervisor, do the online assessment, and complete the training, and the ergonomist will get hold of you. And that was pretty much that process. It really wasn't super detailed. Obviously, the larger your organization is and the more moving parts you have within that organization, a little bit larger that ergonomics process is going to be. The one I started writing up here for Seattle City Light is a little bit bigger. It's probably about 14 pages. So it's going to depend on the size of your organization and how big your ergonomics process is looking.
Okay. What do you think are the current research needs for the ergonomics community to make it easier to cost justify ergonomics improvement activities?
Ooh, that's a good question. I think there needs to be a better understanding from a financial perspective of how ergonomics can really drive down costs, and that dollar spent is a smart dollar spent. And I think the education in this regard is being able to show, like I showed with that ROI metric spreadsheet that I built. We have high-risk employees. You give me the money to fix this high-risk employee's issues, whatever it may be. This is the money we saved, and it's right in front of them, and they understand, hey, we could have been on the hook for this, but we were only on the hook for this. And I think there has to be a lot more of an understanding by management and by finance folks to see that, you know, if you spend that dollar, down the road you're going to get that productivity increase. So any type of medical corrective action where you mitigated a potential comp cost, and then anything that impacts productivity to where it makes more efficiencies and you can see productivity being driven up. Those are the two financial markers that I think really need to be understood and driven home.
Okay. Early on in the program, you talked about where is your program and the different levels. What is your experience as far as how long it takes to get your program from reactive to proactive?
I would say probably 3 to 5 years. And wow. I say that just based on my experience of what I did down at Honeywell. It takes a little bit of while to get your metrics built. It takes a little bit of time for your case studies to really flesh out and evolve and give you the data that you need to show folks that this is a really smart way to go. So I would say 3 years. If you're starting from scratch, probably close to 5 years to really be an efficient, proactive, fire and forget kind of a program. Yeah.
Okay. Looks like we got time for one more question. Is the use of leading and lagging indicators throughout the development process important?
Oh yeah, absolutely. Leading indicators are real-time kind of indicators that you can say, okay, the process is working pretty efficiently. We're really good. The lagging indicators can show you an annual roll-up of what you've been doing, and some archived lagging indicator data can actually, if you're building a process from scratch, that type of archival data is really smart to have, because then you can see trends and analysis over time and take that data and really kind of get finite and granular as to where you need to go with your process. So yeah, leading and lagging indicators, you'll always need both of those. You'll never get to a point where it's just strictly leading indicators.
Okay. Let's see. One more question I think we're going to fit in here because it just came in response to your other question. You were talking about using case studies, and one of our attendees wants to know if this refers to case studies produced within your own company or from other successful Ergo programs.
I would say both. You want to use a case study for your own people because they want to be able to physically see what you're doing, and they want to be able to physically understand that impact within their own organization. But it's also good to have additional data once you've wrapped up your case study to support what you've done, because it's more fuel for that fire. So yeah, I would say both.
Okay, great. Well, I want to remind everybody again that Keith will be speaking at the Ergo conference this November. And thanks, Keith. That was a great presentation. Really appreciate it.
Appreciate it.
Thanks to everyone also, Bill Pace and everyone at Cardinus, and thanks to everyone who attended. Don't forget the Ergo Expo this November. Webinar attendees will get an extra $50 off registration. And also, we're going to have more webinars coming up, October 28th and November 11th, so keep an eye out for emails announcing those. And with that, we've come to an end of this webinar. Thanks again, and have a great rest of your day.